Hi everyone! Now I'd like to go over a few slides on how to monitor fatigue and freshness. So first of all, you would conduct a physiological assessment. Is the athlete improving in their performance? Or is it your client improving in their performance? So this is done through spot checks, mid-tests, also known as spot checks, heart rate variability, so you can monitor that in morning resting heart rate, or in an individual's response to steady state exercise. If the heart rate is increasing, that might be a sign of overtraining. If the heart rate is decreasing at the same relative exercise intensity, that is an indication that the person has adapted to that training load. The second way to monitor fatigue and freshness is tracking training load. And this is as calculated by session duration times or multiplied by some sort of intensity factor. And in this case, I always say session RPE. So how you rate that perceived exertion of that session. So it's volume times intensity. So an increase in training load by greater than 15% from the preceding week increases the risk of injury by up to 50%. Now that is average values. Not everyone will respond that way. Some individuals can handle a lot of volume, but a general rule of thumb is that fact there. The third piece to consider when monitoring fatigue and freshness is subjective questionnaires. So this is asking individuals, your client, how they're feeling. So subjective feelings are the most reliable indicator to monitor. So you can monitor mood through self-rated scores out of 10. You can use something called the REST Q, which is also known as the REST questionnaire, to indicate how fresh or fatigued the individual is prior to training. You can use a very valid and reliable psychological test, which is known as the Profile of Mood States, or POMS. And I commonly use a modified Hooper-McKinnon scale just to get an indication of sleep quality, sleep quantity, how they're feeling, their readiness to engage in exercise, as well as their mood state. These three factors are very important when considering fatigue and freshness, and whether your client is actually adapting to the training sessions or they're just constantly fatigued and you're not seeing any performance changes. Okay, so a quick little summary on monitoring freshness and fatigue. What I like to include is a basic daily monitoring tool, and this should include monitoring the individual's resting heart rate. So this is as soon as you wake up, not to an alarm, because the alarm will increase your sympathetic nervous system activity and increase your heart rate. But this is when you've been lying in bed for 5 to 10 minutes and you slowly take your resting heart rate. That's the most valid indication of your resting heart rate. And then tracking that over time. So usually when resting heart rate increases over time, that's an indication that the person is fatigued and that they could be getting sick. If morning resting heart rate is stable or it's actually decreasing, that could be a sign that you're actually having a training adaptation. Second of all is the quality of sleep. So I ask my client, how'd you sleep? How long did you sleep? And how was the quality of your sleep? And then I also ask my client about their mood. How do you feel? How's your eagerness to take part in activity, etc.? So subjective feelings still are considered the most reliable indicator of problems and concerns because the person knows themselves the most. And this is very important to ask your client how they are feeling. So, and being flexible with that. So if they're not feeling well one day, then you wouldn't do intensity that day. Instead, you might do a lower intensity session or an active recovery session. So the most important question to ask on a daily basis is, how do you feel? How are you feeling today? Are you feeling tired? Are you feeling energetic? Are you feeling whatever it may be? That's very important to ask. So individual monitoring is based on the person's needs. And so consider all these things when you're monitoring your client. And this is an area that's very overlooked when in program design is the monitoring piece. You want to ensure that your program is setting yourself and setting your client up for success. The best way to do that is to get subjective feedback from your client on a daily basis to ensure you're prescribing accurately what they need. Now let's talk about something called overtraining, and this is defined as excessive frequency, volume, or intensity of training that results in extreme fatigue illness, or injury. So the first state is called overreaching, where you've identified that you're extremely tired and that your performance isn't necessarily improving. Overtraining is a chronic state of fatigue, illness, or injury. And it happens because you're just training too much. You're overtraining. Okay, it's often due to a lack of sufficient rest, recovery, and perhaps nutrient intake. Excessive training on a short-term basis is called overreaching. So you can see in this graphic here, we have our results on the y-axis and time on the x-axis. So you can have in green there a hard training day, which leads to A, which is accumulation point. Our skill is the highest. Okay, and then B is the decision point made by the coach or yourself, where you either have appropriate rest to allow yourself to adapt and see an improvement in results, or you continue to train and not have appropriate rest, which leads to overtraining. And this happens over time. So when you don't have enough recovery and rest to adapt, the body gets fatigued. And as a result, you start to see decreases in your performance, in your mood, lots of different factors. This table was taken straight from the National Strength and Conditioning Association's Strength and Conditioning textbook for the CSCS exam. Here it's the theoretical development of anaerobic overtraining. Okay, so what I want to draw your attention to is the stages of overtraining on the far left side. So we have acute fatigue, we have functional overreaching, which then goes into non-functional overreaching, and then overtraining syndrome. Okay, so the first, acute fatigue, happens within days. There's no effect on performance, or you might actually see an increase in performance. And from the neural standpoint, it's really altered neural function. For functional overreaching, it happens with days to weeks. We see a temporary decrease in performance, and this might be that high training load, multiple weeks of a hard camp. So you have a temporary decrease in performance, and then it returns to baseline with appropriate rest. What you're really affecting is the nervous system. We have altered motor unit recruitment when you're fatigued, and the endocrine system, where you have altered sympathetic activity and hypothalamic control. Then we move into if this is chronic, so you're not having enough recovery and rest, it can then lead to the third stage, which is non-functional overreaching. And this happens for weeks to months, and you actually see performance starts to stagnate. So we have stagnation, or it decreases, and we have multiple factors going on here. It's not just neural and endocrine. We have skeletal muscle effects on the excitation contraction coupling. We have decreased the amount of muscle glycogen because you're chronically fatigued. We have increased resting heart rate and blood pressure, altered immune function, and now we're getting the psychological effect where we have mood disturbances. Now the next stage is overtraining syndrome, which is a serious condition, and it can pose a lot of health complications. This is when you're chronically fatigued for many months to years. And here we see performance is extremely decreased. So we're past the point of neural. Instead, we're moving into the action. So we see a decrease in force production, decreased glycolytic capacity due to inhibition of enzymes. We have effects on the cardiovascular system that's not noted here. The immune system, you're sick and you have more susceptible to infections. You're immunocompromised. And then the psychological piece is you're emotional, you have lots of sleep disturbances, and you're extremely moody. So the goal obviously is the prevention of overtraining and injuries. And you really want to, and this can be achieved through appropriate goal setting, planning, and monitoring. And this is why monitoring is so important. And you ask those questions. How are you feeling? How did you sleep last night? How would you rate your fatigue today? All of that is very important, because if one of your clients rates that they have high fatigue, that they're grumpy today, that they slept really poorly, then you may be flexible enough to change the day, because you know that the quality of their workout will not be very good, and you might dig themselves into a fatigue hole such that they can't recover, and then they'll start to get into these stages of overtraining. So you really have to be mindful of this. This will set your program up for success, your client up for success, and you will be deemed a great a really good trainer because you listen to your client. So lastly, let's discuss some of the markers of anaerobic overtraining, which can be also similar to aerobic overtraining. Anaerobic overtraining is when you're doing a lot of intensity. And so you're utilizing a lot of anaerobic metabolism and stimulating the sympathetic nervous system and the neural endocrine pathways. So mistakes can lead to anaerobic overtraining. That chronic use of high intensity or high volume or a combination of the two can result in this. As well, too rapid a rate of progression for your client can lead to significant fatigue. Also, there are psychological effects that we see. The classic markers are decreased desire to train, decreased joy from training. Psychological alterations are often observed before actual decreases in performance occur. So the psychology, and I remember in the sport of cycling, you train a high amount of volume. And you combine that as you increase your training age with a high intensity at the same time. And I remember times where I just didn't even want to train, but I would just roll through the motions. And after a week or two, you'd be so chronically tired that it would take about a week off the bike entirely, or even 10 to 14 days during the season. You would have to have a mid-season break of that amount of time to resharpen the saw, so to speak, and get your psychology back in check so you have that drive to train and drive to excel. Otherwise, I compromised my performance in competitions because I was just mentally fatigued. And I'm sure some athletes out there, if you're listening to this, you probably have experienced that as well, where you're just chronically tired. And so your brain dictates how you're going, your physiology. So you feel tired, you feel fatigued, and so you don't perform as well. And then obviously a classic marker of anaerobic overtraining is decreases in performance decrements. And although these occur almost too late to be a good predictor, so they happen after the fact. It's a lag effect that we see performance changes after you've already induced fatigue. So just be mindful of those markers of anaerobic overtraining. Here's a quick summary from this week's content. Before putting together a training program, ensure you address the 5-step process for program design: mode, frequency, intensity, duration or time, and progression. You want to revisit all 5 characteristics or considerations when changing the training prescription. So when you're making a new program, you want to go back and identify that 5-step process to ensure everything is in line. You also want to ensure you are tracking training and monitoring fatigue and recovery. So what I mean by tracking training is you're tracking the training load, the duration times the intensity, and then getting this arbitrary number with arbitrary units and tracking that over time and monitoring fatigue through sessional ratings of perceived exertion, also allowing appropriate recovery. So you want to continually monitor your athlete for continual improvements, and this can be done through retesting and to show that you're not stagnating performance, that performance actually is not decreasing, to avoid overtraining and stagnation.